Okay, so this is our patient panel, and hopefully when you hear them speaking, you'll relate to some of the stories they have to tell. We'll try and have some open time where you can ask some questions and those kind of things. And with that, I'll let Mary Ann kick it off. And I'll stay around here in case you want to stay.
Oh, you want to sit, Rob? Patient? Okay. So I hope everybody got a lot of information this morning, and we're looking forward to the afternoon. So the patient panel is the voice of a patient, and so what we're going to do is give you a little history about each of our diagnoses, a little bit of our stories, and then we'll be able to have a few questions if you'd like to ask. This is Larry. Larry is the Tampa support group leader. This is Rhonda. Rhonda is the West Palm Beach leader. And me, I'm just here. So why don't we start with Rhonda?
Okay.
And she's going to give you a little bit of her story.
Hi there. First of all, I want to ask Michael if you could give us a arms up there. If you are in the West Palm Beach area, I think we have people down from Fort Lauderdale all the way up to Stewart or wherever. We have a meeting here, and he is taking, if you want to write down on a piece of paper, your name, address, email, your stats or whatever, I can find you. So if you want to join our group, that's where he is. Okay, so my story is a little interesting. I am here, and it's all her fault because she saved my life. So I had 15 years of IBS diagnoses, all kinds of stuff. I was even under psychiatric care because I was having panic attacks, panic disorder, and that coincided with very low blood sugars. But nobody could put it together. Long story short, I ended up having a tumor in the head of my pancreas. So I ended up getting a Whipple. Is there anybody else in here who's had a Whipple or is looking at having one? No? Okay. Oh, a few. Okay. Come talk to me. Another one. I had the Whipple, and after the Whipple, I had negative lymph nodes, all that kind of stuff, and my doctor told me I was cured, which really made me happy. So one of the things that came from the Whipple is I'm a nurse, and I had a ton of questions, and they didn't have any information for me. And I thought, if I'm having all these questions, what about somebody who's not in the medical profession, and you get lost after you have a Whipple? So I started the Whipple Warriors, which is it's a global group now, and we have members from, 30 countries and every state in the United States. It's the biggest organization for Whipple patients now. But along with that, I started looking for, to network and find different Whipple patients. And one of the groups I hit up was Mary Ann, and she and I got on the phone, and I immediately informed her that it was wonderful because I was cured. And she says, "No, you're not." And I didn't believe her at first, and so she ended up telling me, you need follow-up. And then I went to one of these conferences, and I met some very intelligent doctors, and they were telling me, one said I was cured, not cured, but he said I didn't have anything to worry about, and then the other one said you need to be vigilant and keep an eye on this. A little while later, Mary Ann says, "Did you get anything done? Did you get any follow-up?" No, no, no. A year later, we hit it off, and we became good friends. A year later, she says, "Go for a scan. Just do it for me." It was in my liver at that point. So I went from saying I was cured, I had negative lymph nodes, to here it is in my liver 4.5 years after. And so she's responsible for me being here right now. It's all her fault. And I've been doing good. I ended up with, I'm on Captem right now, and I've been on that for a little while. I am no evidence of disease for almost 3 years. I do see Dr. Anthony. Where is he? Oh, anyway, shout out to him. Okay, so we won't tell him that I said that about. But yeah, so he's my doctor. I fly up there. I have a local person here in Palm Beach County who has many NET patients. It's important to find a doctor that does NET patients because, as you know, we're a special breed. And so I have a local guy, and he works in conjunction with Dr. Anthony. So that's what Dr. Anthony was saying, that it's good to have like a local person kind of, we call it like a quarterback, They talk and they discuss what's my best options and stuff. So I'm doing good. And on January 28th, it'll be 10 years since my Whipple. So woohoo. Yeah. Anyway, so that's my story.
And Larry, you want to share your story?
Certainly, Marianne, and I think my name is Larry. I'm from the Tampa Bay, Florida area, and I'm serving as the leader or coordinator for the Tampa Bay chapter of NCAN. But I'd like to just take a moment to really pause and to recognize the tremendous work that both Robert and Marianne Wayman have done on behalf of all of us and all of the survivors of carcinoid cancer, of which there are many, many thousands, due to their heroic efforts and the painstakingly personal efforts they've given. They have educated dozens of doctors that are now at centers of excellence. They're involved with getting funding for research grants. I mean, their work is just phenomenal, and this conference had been in the works for planning for many, many months, if not years, and Rhonda made this happen with Marianne and Robert, and they really deserve special praise. Please join me. And I think from the presentations this morning, I think no matter how many conferences I've been to, the amount of information to try to absorb is overwhelming. And I would just encourage you not to be at all overwhelmed, but just to pick out what's applicable to your own individual situation. If you have a midgut carcinoid tumor, focus on that. Don't worry about lung nodes or other permutations, because it is just such a vast area. But I'm extremely fortunate. I was diagnosed in 2005 with a midgut carcinoid tumor. I went through bowel resection surgery, and I'm having a fairly good follow-up. But I would urge all of you to really be extraordinarily vigilant with surveillance and follow-up, no matter what any medical expert may tell you. There's some very recent publications out of Canada that show that surveillance, even after one may be considered to be doing very well, as I understand the study, and as it's been interpreted by an expert up in the Northeast, he said you should really be on lifetime surveillance. And the 3 points I'd like to share briefly here, I don't want to take away from time the others will have to present, really have to do with echoing, but I can't emphasize each of these points enough. The critical importance of seeking out a truly distinguished, recognized carcinoid expert at a center of excellence that's usually affiliated with a major teaching hospital university. That is of, I think, you really, no matter where you are in your stage of diagnosis, treatment, cure, survival, getting the right expert that is really distinguished, no matter how far you might need to travel. And this took me a long time to grasp, but my doctor, wonderful, could really be your doctor, terrible. I don't know how to explain it, but doctors that I have a wonderful rapport with, other patients may not. And it's really important to seek out the doctor that is the best doctor with the most experience, that you have the most rapport with. And I really feel that they can work, as Rhonda and Marianne have mentioned, with local oncologists. But because this type of cancer is so different from any other type of cancer I'm familiar with, and as Dr. Anthony was pointing out earlier, it's the pyramids are the exact opposite. It may have been Dr. Wang, but what normally, if you present with a tiny tumor to a regular oncologist, they're going to think it's a small problem. It's not. It's the exact opposite. So you really need to have a really good expert at a center. I think not only does Marianne and Robert's website give you a lot of information, also, as she mentioned, the Carcinoid Cancer Foundation, which Dr. Warner helped found back years ago, has a wonderful list, and the blue box doctors there are really, I think, superb. The second thing is the critical importance, I believe, of doing whatever you need to do to get approval and get a Gallium-68 scan ordered. If a doctor is recommending an Octria scan, I would really sincerely get a different opinion. The Gallium-68 scan, which was available in Europe for over 20 years and it's really being surpassed by more sophisticated studies they're developing there. But in the United States, it was only approved maybe 2 years ago, if that. And that is of critical importance. It can give you a roadmap on where you are in your stage of disease. And I think you really can't do much without a Gallium-68 scan. The final thing, I think, is just to echo what is really the essence of Robert and Marianne's lifetime mission, is you've got to be a patient advocate for yourself. You've got to know what questions to raise with physicians, how to raise them tactfully, and how to press to make sure you get an answer to your questions. And I would submit to you that 3 things I found have been very helpful in accomplishing that, and then I'll turn the microphone back to Marianne. They are, I would prepare in advance of any significant physician carcinoid doctors meeting, whether it's with a regional center excellence person or your local doctor, an agenda of 3 or 4 points you want to cover in the meeting. I would get them that agenda to their staff and to themselves maybe a week ahead of time, and I'd bring extra copies in case it got lost or there's a fellow or something like that. Not only do I find that it helps focus what are my problems, but it also gives the doctor a really good idea of what you're going to discuss, even if they don't look at it ahead of time, as often may be the case. I find that it really, some doctors it doesn't work, then don't do it. But for the most part, I've had very good success doing that. The point Marianne makes about having a second person with you is very important. Dr. Gene Waltering, who was just an icon or god in this field, he encouraged patients to tape record their meeting, and that was invaluable. A lot of other doctors may be a little hesitant. I've been hesitant to press that because they may feel for medical legal reasons there could be some problem with their university. If they'll let you do it, you've got to get their permission, do it. If not, you need to have a second person with you that can focus on taking notes, that can go back over and make sure you've covered every item on your agenda. But I think if you do that, and if you hit these patient conferences where what an opportunity to meet personally Dr. Anthony, Dr. Wang. I mean, it's a phenomenal thing. And Marianne and Robert do a national conference every 2 or 3 years where they have the people from around the world that come. You have an opportunity to speak with them. They can help you get into clinical trials that Dr. Strausberg, who's very highly regarded, will be discussing later today. You can meet other patients and find out about different treatments, etc. So with that, I'll say again a big thank you to both Robert, Marianne, and Rhonda, and I'll turn it back to Marianne.
Okay, so I started a little bit about my story, and I was misdiagnosed for 7 years. 7 different doctors, 7 colonoscopies, 7 endoscopes, and finally, thank God, my 7th doctor was willing to look outside the box. And he said to me, Marianne, has anybody ever used a pediatric scope on you? I was in my late 30s. I was like, what the heck are you talking about? And he said, listen, it's longer, it's more flexible, and I can get up to the ileum. What do you think? I said, if you think it's going to work, that's fine. I said, because I'm telling you now, you go in there, you do not come out until you find out what the heck is going on, because I've had it. During that 7 years, I not only had diarrhea numerous times, 40 times a day at some places. I couldn't leave my house. I missed a lot of events with the family and stuff because I couldn't leave the bathroom. And I was bleeding from the rectum so bad that I was having blood transfusions. Yet they kept on telling me it was in my head. So, you know, he used the pediatric scope, and sure enough, that's where he found it. And I'm very, very grateful for him, because had he not, I was really, really going into a really deep depression about it. So I had my small intestines resection. At the time, They took out my small intestines. They took part of my small intestines, part of my large intestines, my ileocecal valve, my appendix. And back then, they didn't take out your gallbladder. And of course, after 6 months of being on standard I started with sludge and stones. So 6 months later, I had to go in and have my gallbladder removed. Several months later, from all the years of the diarrhea and the burning, I had actually torn open my rectum, and I had to have that repaired. I was diagnosed as stage 4, and my Ki-67 was 2, and they started me on standard right away, thank God. And I did standard for a very long time. My syndrome was so bad that I actually was taking 4 times the normal dose. I was getting 4 injections a month at 30 milligrams for over 8 years. I continued to have severe syndrome even with the 4 shots a month and was giving myself sub-Q shots of octreotide several times a day. Thank God I had doctors that thought outside of the box and set me up with a insulin pump that I had attached to me 24/7 with 24-hour infusions of octreotide to stop the syndrome. And that controlled me for many, many years. Unfortunately, it started again, and I was going to the bathroom 20, 30 times a day, and I started Zormello. And that really helped my situation. Unfortunately, we had a lot of stress in the family the last couple of years, and I had to stop the Zormello because I was having issues with constipation. And I was concerned that I was going to have a bowel obstruction, but it wasn't caused by the Zormello, which we found out in September. In September, I had a hiatal hernia that I had had for over 10 years, and I totally ignored it. I got to the point 10 years ago where I stopped eating, and I was only eating 1 meal a day because I couldn't swallow. And what we found out is that when I went for my Gallium scan, rechecked for my Gallium scan, the tumors in my mesentery had grown, but they noticed the size of the hiatal hernia and said, "Are you aware that half of your stomach is in your esophagus?" And I said, "No." And the doctor said, "Well, you know, how long has this been going on?" And I said, "Oh, a couple of years." Robert goes, 10. I said, "Oh, it hasn't been 10. 10.
Sandwich bag full of all these little pills.
I was taking all kinds, they were giving me all kinds of pills for acid reflux. And because of the high mega doses of standostatin, I got sludge in my common bile ducts. So I would have to go every 6 to 9 months to have that cleaned out. So not only was I having the heartburn, and I couldn't swallow, but then I was having bile attacks in the middle of the night where I was aspirating, and I was going 5 times a week. I was vomiting during the night. And so, like I said, I was doing that for like 10 years, which only seemed like 2 years, but it was 10 years. So we decided that I need to have surgery. So in September, I had the tumors removed from my mesentery, which turned out to be mid-grade. And they decided to repair the hiatal hernia, which they had to pull back through my diaphragm, put mesh and everything else. And when they went in there, they also found 3 abdominal hernias that I had been walking around with for the last 18 years. And they also realized that the resection that they had done 18 years ago had started to narrow from adhesions and scar tissue. So again, I ended up having to have another resection done of my small intestines and colon. So what we thought was going to be a 2.5-hour surgery, 3-day stay ended up being an 11-day stay. It's about 6 hours worth of surgery, and I strongly believe that you need a patient advocate. And had Robert not been there with me, I don't know if I would have survived. Because of the surgery for my hiatal hernia and the esophagus, everything was closed up. And so they were trying to do the NG tube, and they couldn't get it down. And they kept on trying, and Robert just finally put his foot down and said, "Enough. You can't do this anymore. You need to stop." And they finally called in a specialist and actually got an endoscope a GI doctor to come in and put me out and do it because they couldn't get it to go down. And, the doctors had warned us, but, you're at a teaching hospital, so they send in interns and fellows, and, they don't know what they're doing, and it becomes a real issue. Another issue I had was I am very sensitive to amino acids. I cannot eat turkey without going into a carcinoid crisis. And this does not happen to everybody, and that's when I say everybody's so different. For 4 years, I would eat turkey and end up in the ER on Thanksgiving, and they always told me I was passing a kidney stone, and I thought that was kind of strange before my diagnosis, that I would only pass kidney stones on Thanksgiving, but that's what the hospital said. So they had a PICC line put in to feed me in the hospital, the surgery, and I didn't look at the bag of what they were giving, and I became very, very ill with severe diarrhea, heart palpitations, flushing, and I kept just saying to Robert, I just don't feel good, and the nurses are coming in and saying, you have to keep walking, you gotta keep walking, you're never gonna get out of here, you gotta keep walking. And so finally, I looked at the IV, and it says amino acids, and I went, oh my gosh, this is what's going on. I was having carcinoid crisis, and they did not know it because they were pumping my body fast with IV amino acids. And like I said, I don't want to scare anybody. If you have no problems with turkey or anything like that, it's fine. It's just that I am super duper sensitive. I have, my tumors secrete histamines. I have a histamine attack every night. If I don't take Benadryl and I don't take Zantac, I will wake up with lumps all over my body. So between the histamine attack and the amino acids, I was having a carcinoid crisis. So I ended up having to stay a few more extra days. I lost over 32 pounds with it. Not exactly the way I wanted to lose weight, but that was September 3rd. And finally, the last 2.5, 3 weeks, is finally able to eat again, because they were getting very concerned because I couldn't swallow. And I'm doing much better. But honestly, I've been truly blessed because the last 18 years I've had carcinoid syndrome. Yes, I have been in the bathroom a million times, but I'm still here. I am still waking up every morning. I get to see my grandchildren. I get to see my family. And this is what you need to remember. You're here. Make the most of it. Make the most of every single day. 8 weeks ago, Rhonda had a little baby grandson be born. And had she not followed what I kept on pushing her, she wouldn't be there for that today.
I want to say whatever, but yeah, you're right. And I appreciate it.
Rhonda has another grandchild that's on the way and that should be delivered by Monday. So,
honestly, I never thought I'd live long enough to see one,
right.
let alone two.
And like I said, when I got diagnosed 19 years ago, they told me I had 5 years. I never thought that I would have my children's weddings, their graduations, my grandchildren. So look forward to things and try to live life. Don't sit home. Just go out and do things. I don't care if you get in the car and you just drive 15 minutes every day. Do not sit around and think about it. The biggest thing I'm going to tell you is those Facebook pages, while everybody thinks they're fabulous, sometimes they are the worst thing in the world. Because the people that go on Facebook, 99.9% are there to complain. They're not giving you positive feedback. So also take it with a grain of salt. They are not run by doctors. Even if the doctors' names are attached, they are not run by doctors. They are run by patients and caregivers. So they're giving you information that is not always 100% true. So please, please, please listen to the doctors, ask questions. Always ask questions. Don't just assume because you saw it on Facebook and it's on Dr. Lou's Zebras that it's fact, or on Dr. Wang's group, or Dr. Walting. Unless it's coming from the doctor itself, do not believe it 100%. Do not believe these cure-alls that they're putting out there, that if you take this, you're cured. It doesn't happen.
Well, it's not cured. It's monitor the rest of your life.
This is it. It is for the rest of your life. It is not 1 year. It is not 2 years. It's not 5 years, not 10 years. It is forever. Like I said, 19 years, this was my second surgery. 19 years it took for that tumor to grow big enough that it was causing more problems, okay? Also, the size of your tumor doesn't matter. I don't care if it's 2 millimeters or it's 2 centimeters, 6 centimeters, 10 centimeters. If your tumor is causing havoc, it could be 2 millimeters, can cause just as much damage as somebody that has a 6 centimeter tumor. Your syndrome could be just as bad. So don't always assume just because of the size that that's the reason, okay? The advocacy for yourself. Every time you go to a doctor's office, you have a scan, you have blood work, you have whatever, you take those records with you. Do not leave the office until they give you a copy of the disc. Right. Because then, if God forbid you need to go and see a specialist, you have all that information. Make a notebook, put it in there. Track your markers. Keep track of all this stuff. And that is how you can be your own best advocate. Another thing is that keep track of your symptoms. If you're finding that you're having a lot of symptoms, make sure you keep track of it. Bring it to the doctor, because I know, I've done it, I'm guilty as well. When you get in the doctor's office and the doctor comes in, you talk to the nurse, and the nurse says, "How are you doing?" "Fine." "Are you really fine?" "Yeah, I'm fine." "How many times have you gone to the bathroom?" "Oh, just a few." "Well, how many is a few?" Just a few, no big deal." In the meantime, I'm in the bathroom 25 times, but I don't want to say that to the doctor, because you don't want to disappoint the doctor, because you think that if you say, "Oh, I'm going to the bathroom 20 times, then he's going to up my standostatin, I'm going to get another shot in my butt, or this, that, and the other thing. So please make sure that when you go to the doctor, you're honest with them. Tell them what's going on. I have lupus and I have ITP. My oncologist that took care of me for that, if I had said to him that I was flushing, I would have been picked up immediately. But I didn't. I run fevers at night, so I was starting to run fevers during the day. I didn't think anything of it. After 5 years of doing it, I would go into the closet, I would pop 2 Tylenols and forget about it. And when I got diagnosed, my oncologist said, "But do you flush?" And I was like, "No." And he said, "You're flushing now." And I was like, "No, I'm not." I said, "I'm getting a fever." He's like, "No, you're flushing." "How long has this been going on?" "Probably about 10 years, 12 years, 15 years, I don't know." He said, "If you had said something, I could have diagnosed you with carcinoid much sooner." So it might not seem important to you, but always tell the doctors. You know, little things you need to tell the doctors, or otherwise they're not going to know. They're not mind readers. So make sure that you are honest with your doctors and tell them what's going on. There was one other thing I wanted to make sure.
Oh, what was that?
I don't know. I don't know, I'm sorry. But those are, but it'll come to me. But that's really important, is that you talk to your doctors. Also, make sure that you do get to a specialist one time in your lifetime, please. It's very, very important. It's important that you stand up for yourself. Don't take no for an answer. And that's about it. Does anybody have any questions?
Anybody want to ask a question? No?
I just was curious, when Patty, we're seeing Dr. Hossein down here in Sylvester Cancer Center, and they're starting to do these, I guess I've been doing them now successfully for about 4 years, and it's where they replace everything inside your gut. And for patients like her, where you have, it got so big that they couldn't remove it, and then it's already spreading into the liver and such, and so they're doing, what's it called, multivisceral. Yeah, but they're successfully doing them down there, I think.
It's MVOT, multivisceral organ
Yeah, at Jackson Memorial, right? They're doing it at Jackson Memorial.
Yeah.
But nobody's kind of mentioned that's also another
Option.
thing that's out there that where if you get into a case like that, it can, and when they do it, it pretty much eradicates it in those cases, and then it's gone, and you got a new system. But then you're fighting rejection
issue.
with different organs and stuff. But you go back to like eventually, like it takes a year, they said, recovery, but then your plumbing works right after that.
Right. We have quite a few successful. Rodriguez Vienna is one, and there's also one that used to do it in Indiana. I can't think of his name right now. But actually, Dr. Waltering has retired, and his replacement is also a multi-organ transplant woman. So yes, there are several survivors and have had really good success with it. So if anybody wants to find out more information, they can contact us and we can put you in touch with patients.
Other questions? Anybody got something? No? Well, I could just share a little bit about from the caregiver point of view, it's, when your loved one gets sick, so you think about them first. That's how it starts, and so that's what happened with her. But then in September, now it's been, what was it, like 19 years, right? Like 19 years that I've been doing like a support role, and so I have seen a lot of things, know a lot of things about it. But that's not really the point. What went on, like when they put in the NG tube, right? I don't know what it means, but it might mean nose gut. I consider it the no good tube. They stick it down, and they need to do it. It suctions out bad stuff out of your stomach. And, what happened was they had done this. And the surgery she had, they took her stomach and kind of wrapped it once around her esophagus, and that keeps the GERD, keeps you from having reflux, right? So the surgeon had said to me, she's done, but when she comes out, you're not going to be able to fit anything down. You'd be lucky if a burp could fit out of there. It's swollen. They just worked on it, right? They take her up. They want to put this tube down. I said, well, the surgeon said such and such. They said, well, whatever. And as an advocate, Marianne said earlier, it's not adversarial. So the way you got to look at it is you're a part of the team, right? They didn't draft you. They didn't want you on the team, but you're part of that team. And that's a place where you have to respect them. I don't tell the doctors what to do, but by the time it was an evening, right, because they had done a few things, and then in the evening time, the order comes up on the screen or however they get it, and up comes a resident, and the way this works is that the resident who's coming up to do this NG tube has never done it before. I don't know that for a fact, but he comes up and he doesn't really know what to do. The respect is he might have just saved somebody in the ER who was having a heart attack. So you can't say, well, he's some idiot. He's some doctor who is not able to perform this thing. But it's his job to do it. So he tries, and after a while, it's kind of obvious that it's just not going to happen. It's like, could you bring somebody else in? I'm not trying to be insulting or anything, but you do the same thing 10 times and it doesn't work. It's time to try something else. And he said, well, if that's what you want. So another resident comes up, same thing. Third one comes up, says, well, I've done this before, and I spoke with the fellow who talked to the doctor. I said, did she talk to the doctor? Well, she says, soak it in ice water, and then it'll go down. I said, well, I'm not a doctor, but you're going to soak this in ice, and it's supposed to go like this. How is it going to make that turn? He said, we got this. So I said, okay. I said, it's up to you. And she said, all right, let them try it. But it literally, when they put it in, it was so stiff that they pushed, and her head was bending back. And I said, you know what, guys, you're done here. Well, something has to happen. If you have to do it, it's a dangerous situation. I said, yeah, but what has to happen. You have to get a gastroenterologist and place the tube down there. You already know that that's what has to happen. Okay, so up comes the fellow and says, all right, we called the the GI doc, and they'll be in about 45 minutes, 1 a.m., and they'll do it. Meanwhile, we're going to try to get this tube in. I said, you have to forgive me, but it doesn't sound like it's about medicine. It sounds like it's about your ego now. You want to keep trying so you can tell the GI doc that you did it. Well, we should. I said, just wait. So that's the long and short of it. But you can't allow them to do things that really don't make sense, and that's really what the advocacy is about. It's like, why would you do that? And if they have a good reason, again, I'm not a doctor. I have no idea what they're going to do. I'm not going to say, hey, you want me to hop in on that operation over there? That's a problem. But that's really what you need to do as a caregiver. Just be aware, be around, help with the research, that kind of thing. Any other questions? You got questions? Anybody got comments, questions, anything?
I finally thought of what I was supposed to say.
What's that?
I finally thought of my thoughts. Okay. So one other thing that's very, very important, not only for the patient, but for the caregiver. You get so roped up into your neuroendocrine, you forget about the rest of your body, your mind, your body, and your soul. It is very important that you still go for your mammographies. You still go get your prostate checked. You still go for your scans. You still go and if you need to go talk to somebody to mentally give you help, that's fine. It's nothing to be ashamed of, okay? But it's very, very important that you remember to take care of yourselves. And this is important to the caregivers as well. You cannot take care of the patients if you're going to be sick, okay? And what I see a lot happen is that if you look around the room, sometimes the patients look better than the caregivers because they're so stressed out about taking care of the patient, they forget about themselves. So you really need to remember to take care of yourself. Go get your physicals. Go get your mammography. Just because you got carcinoid does not mean that you can't get breast cancer, you can't get prostate cancer, you can't get colon cancer. I know a lot of people who get colon cancer. People get secondary diseases, autoimmune diseases, and stuff like that. Just because you have carcinoid does not mean that you are exempt from anything else. So please make sure you do your follow-ups. That was it.
One of the things that she was talking about, mind, body, spirit, and so here I go, woo-woo. I don't care what your faith is, or if you don't have a faith, or whatever. My personal truth is that I do, and it's the mind body is so important. So if you're having stress and you go talk to someone, I'll tell you the truth, I did, and I found a therapist who helps cancer patients specifically. And I'm just going to throw some stuff out there that came to my mind because I know it's coming to yours. Is this my last Christmas? What's going to happen? Your fear of the future is, am I going to die? And all these things came to my mind just like with anybody else. And so she said a really good thing to me that sounds so simple, but it hit with me is the time to worry about dying is when you're like in the process of it. Until then, you need to hang on to your life and live and be grateful that we're here. And again, the mind body, if you need to go feel better or calm and get all your stress hormones down by looking at a sunset, do it. If you feel better with praying, do it. Whatever it takes to kind of lower your stress and everything and stay in the moment of now. The other thing I do want to talk about is scanxiety. That's when we're taking a scan, we're getting ready to take the scan. The first thing that happens is we make the appointment for the scan. Then it kind of gets real, right? And then you take the scan, and the time up to the scan is scary, and then the time after the scan, waiting for those results, is the worst. The only thing I found help, and my husband's not going to believe this, is cleaning out like drawers and staying busy and going out just to get out of that sitting in your little what I call the cave of just sitting there fearful in your cave. So depression's number one enemy is activity. So stay active and that'll help. On another note, you had mentioned about keeping your own information after you go to the doctor. getting your scans. I was telling her that if you get the scan in the paper when you leave, some of these people charge you, when you call back and I need a paper, they'll charge you for the papers or, whatever. So that helps you to be stubborn and stay there till you get a copy of that report from the receptionist. But I had a stack of my own stuff, and I went up to a specialist. And he looked at it and he said, well, I wonder what that MRI was. And I go, oh, hold on a minute. And I pulled out the paper. And he goes, oh, I see you're a professional patient, with that tone. And I thought in my head, damn, if I'm not a professional about myself, who else is going to be? So be your own advocate. Bring your stuff with you. Keep a notebook, mine's chronological, about what happened. So those are just like little tips. But, go into your Zen.
Okay. So we're going to wrap up, but just before we wrap up, I just want to mention, has anybody been to our website? How many people have been to the website? Okay. How many people watch the videos that we have on the website? Okay. This is being recorded. We do not advertise that we record them because sometimes there are errors and we can't use the video, or doctors sometimes don't want them to be videotaped and stuff like that. So what we do is we don't advertise it. So these videos should be up in about 3 weeks, Mike? Okay. Hopefully we'll give him 2 weeks just in case. He does have children. And for those who don't know, my son Michael is back there controlling the camera. This is a family affair. My daughter is outside. Trisha in the zebra sweater. She is also a patient and caregiver. So go to the website, watch the videos. For those who don't know, there's a glossary in there that's very extensive that you can read, like your reports, and get the answers to that. You can send away for your free information packets. You can call us on the hotline, like I said, 9 to 9 p.m., 9 a.m. to 9 p.m. Eastern Standard Time. I strike it again, Eastern Standard Time. And yes, we do answer the phone, Thanksgiving, Christmas, New Year's, and everything else. So thank you all for being here. We really appreciate it. And we're bringing up Leanne.
Oh,
Okay.
I'll-
Oh, go ahead.
Do you find that when you have the syndrome, when it occurs, that your personality can change?
Okay, so there's a thing called Carcinoid of Rage. How many has ever experienced it? Okay, so there's no real data on it, but a lot of us believe it's true. So a lot of time Carcinoid Rage will come just before you do for your injection. Some people find that by taking a sub-Q of octreotide, it does stop the rage. But there is no real, I don't believe there's real data. I mean, I think they've done a poster or two about it. We did a brief survey, but some people do feel that Carcinoid Rage is real. Yeah, okay.